In the name of Allah, who is the most merciful and most compassionate, today I want to continue my previous topic and I want to explain the types of necrosis. Let's start our lecture. We have six types of necrosis. In most books, there are five types of necrosis, but I'm going to explain all of them. First one is coagulative necrosis. I'm going to explain any types of necrosis in three conditions. In which condition it is seen, the process, and microscopically appearance. In which condition the coagulative necrosis is seen? In ischemia and infarcts in most tissues except CNS or brain infarcts. Ischemia is the lack of blood supply to a tissue, and infarcts are the areas of cell death. It occurs because the blood supply is cut to a tissue because of the blockage of artery process. Enzymes or denatured proteinases is blocked. As I told you in previous lecture, denaturation of proteins. There are denaturation of proteins and necrosis. We have two types of proteins, structural proteins and functional proteins. What are functional proteins? These are enzymes. When enzymes in coagulative necrosis, the functional proteins are denatured. When enzymes are denatured, there is no enzymatic digestion. For this reason, proteolysis is blocked because the digestion of protein will not occur. When we see this cell under the microscope, cell maintains its architecture without nuclei because enzymatic digestion is blocked or enzymatic digestion enzymes are denatured, the cell maintains its architecture, but nuclei is disrupted. Finally, eosine binds cytoplasm and the environment will be acidophilic and cell will have red and pink color. Second one is liquefactive necrosis. In which condition we can see liquefactive necrosis? Bacterial abscess and CNS infarcts. I told you about infarcts previous. Abscess and pus will be our next topic. The process, neutrophils release some lysosomal enzymes. In these lysosomal enzymes digest the tissue. Look at this side. These microbes come and damage the cells. These damaged cells and microbes, both of them attract the neutrophils. These are neutrophils. In these neutrophils, release some lysosomal enzymes and digest the tissue and convert them to liquid material. For this reason, we can say or we can call this necrosis liquefactive necrosis. After that, some macrophages will come and inflammatory process will start. If we see this side under the microscope at early stage, we can see cellular debris, liquid-like material, and macrophages. Later, in CNS, there is cystic space, or we can see cavitations. Because there is in liquefactive necrosis, there is enzymatic digestion and cell is converted into liquid material. For this reason, we can see cystic space and cavitation in CNS. And also later we can see neutrophils, cell debris, and bacterial infection here. Third one is caseous necrosis. We can see caseous necrosis in tuberculosis, systemic fungi, and nocardia. Mycobacterium tuberculosis is a bacterium that causes tuberculosis. Systemic fungi. Systemic fungi are a group of fungi that can cause serious infections inside our body. Example is Histoplasma capsulatum. In nocardia, nocardia is a bacterium that causes nocardiasis inside our body. Process, fragmented cells in debris surrounded by macrophages and lymphocytes. We call this process granuloma. What is granuloma? It is a small area of chronic inflammation where the immune system tries to wall up something. Here, the immune system wants off fragmented cells and debris. For this reason, we call this process granuloma. This is immune system here, neutrophils and macrophages. We can see under the microscope white cheese-like gross appearance. For this reason, we call this process caseous necrosis. Caseous means cheese-like. Fourth one is fat necrosis. In which condition we can see fat necrosis? in acute pancreatitis and trauma. I write here enzymatic because there are the rules of enzymes in acute pancreatitis in which saponification of pancreatic fat happens. In trauma, there is no rule of enzymes. Example is injury to breast tissue. The process when the pancreatic cells are damaged, these cells release lipase to convert tag into glycerol and free fatty acids. These free fatty acids bind calcium to make chalky white appearance. We call this process saponification. What is saponification? It is the making of chalky white appearance in this process in which free fatty acids bind calcium and make chalk white appearance. We call this process saponification. Under the microscope, we can see shadowy or unclear outlines of dead fat cells without perinuclei in combination of fat and calcium on hematoxylin in eosine stains appears dark and blue. Sixth one is fibrinoate necrosis. We can see fibrinoate necrosis in immune vascular reactions. In immune vascular reactions, the antigen and antibody complexes are deposited in the wall of the arteries. These antigen and antibody complexes with fibrin. Do you know fibrin? Fibrin is a protein which is leaked out on of vessels. These antigen and antibody complexes with fibrin produce a bright pink and amorphous appearance on hematoxylin in eosine preparation. We call this fibrinoate. We call this bright pink and amorphous appearance fibrinoate. If we see this under the microscope, it looks like amorphous bright pink appearance on hematoxylin in eosine. Fifth one was fibrinoate necrosis and sixth one is gangrenous necrosis. Gangrene is used for death of tissue which happens due to loss of blood supply. It is seen in distal extremity and GI tract after chronic ischemia, after the loss of blood supply process. It doesn't have a specific process, but usually it occurs due to loss of blood supply. Microscopically appearance, we have some types of gangrenes, for example, dry gangrene, wet gangrene, and gas gangrene. Dry gangrene is without infection, and wet gangrene has infection. It looks wet, swollen. These are the microscopically appearance of gangrenes. This was our today's topic. If you like this video, you can subscribe our channel and comment about the topic. Thanks for watching.